Hello, my name is Courtney Robbins. I am a student at Allegheny College of Maryland for the LPN to RN transition course. And today I'm going to be doing a urinary catheter on a female patient. And I have already provided privacy for my patient as well as explained the procedure. I have identified the patient by their name and date of birth on their wristband, and I have already washed my hands. All right, so I've obtained my kit. Turn that just a little bit. And for the use of this, we are using a stuffed animal and like a little Pepsi can, so I have a urethra to use. So I have been practicing, so it is already open, but it would not be opened otherwise. All right, so I'm gonna open it. I'm gonna use this as like a little trash can. I'm gonna place this right over here, my patient's bed. I have exposed everything, ready for the patient. All right, so we're gonna open up our sterile field. I'm gonna turn this so you can see me. Obviously, I would not keep moving a camera if I was actually doing this, but for the purposes of the school, I want you guys to be able to see everything that I'm doing. All right, so I'm gonna open up my sterile field. Again, I've been practicing, so this is a little, all right. Then I'm going to take my drape here, is all I'm touching, and put this shiny part out, and I'm going to put this up underneath my patient's bottom. Ask them to lift up for me. Place that right underneath their bottom. Perfect. All right, so I'm going to grab my sterile gloves, and so you can see the rest of this, I'm going to go ahead and turn it on the patient so you can see. There we go, perfect. All right, so I've got my sterile gloves in a different section that's not over my sterile field. My dominant hand, I'm gonna go ahead and place that one on there just like that. And then this one, I'm gonna go ahead and pick up that's closing on me, but that's okay. Keep my hands up underneath that so I can keep this completely sterile. On the inside, I'm gonna go ahead and pinch this and I put this in the garbage. So I'm gonna go ahead and grip my drape. I'm gonna place this over the urethra of my patient. Just like that. Still keeping that all in a sterile area. I'm gonna go ahead and prepare my kit, which is right here. It's still in that sterile space. I'm gonna go ahead and I'm gonna I would open up my iodine, not going to for this purpose because I don't wanna get everything all messy, but I would open that up and I would pour that over my cotton balls, and then I would just discard that, still keeping my sterile field here. Go ahead and prepare my kit. Here is my lubricant. I'm gonna go ahead and I would push that right into the tray there, just so I would have that as well. Discard that. My hands are still sterile. So this is an open kit just in case I need to collect a specimen, like a sterile specimen for the patient. A lot of times the doctor will order that. So we would just leave that right there in that kit ready to go. And then I've also got my normal saline that I would use. So I'm gonna go ahead and move my tray right here, still in my sterile little field. I'm gonna go ahead and open up my catheter bag here. I'm gonna open that up inside the box so that way if the tip of the catheter falls out, I want it to fall into my box and not into anything else. I wanna keep that completely sterile. There's that plastic. Tossing that right out into the trash can. I'm gonna place this tip right over into my lubricant. All right, so it's gonna stay right there for me. And then I'm gonna go ahead and I'm gonna move this bag right over to, oop, that did not fall out. Normally it stays right in there when it's got the lubricant. So if that would have been the case, I would have started all over because I would never want to contaminate a patient. All right, so I'm gonna go ahead and move my bag right over here. All right, and this is our normal saline to fill up our balloon. So it's gonna go right here in this little port. So I wanna make sure I've got everything done and handled. So that way, once I use my left hand to separate the labia with my fingers, I wanna make sure that everything is ready to go. All right, so with my non-dominant hand, I'm gonna go ahead and separate the labia just like that. I'm gonna grab my little tweezers. I've already got my iodine on there to clean my patient. So with that, I'm gonna go around that one side, toss that right in there. I'm gonna go for a second one on the other side lip. And then one last one, go right down the center. I'm gonna leave and I can actually go ahead and toss those as well because I'm done cleaning the patient. So I'm gonna go ahead and leave my non-dominant hand there because if I release it, then it becomes not sterile anymore and not clean for the patient. So now we're ready to insert the catheter. So I'm gonna grab my tip-in that's already been sitting in my lubricant. And I'm gonna tell the patient to go ahead and bear down for me. I'm gonna go ahead and stick that in all the way until I start to see urine in that bag. And then I'm gonna push it for another 2 to 3 inches for a female patient. All right, so everything looks good. So I'm gonna still hold that and pinching that just so it doesn't move out of place. I don't want that catheter to move because sometimes it will when they start to kind of relax. We're gonna go ahead and we're gonna push this in slowly. All right, so we can go ahead and let go and actually let that release just a little bit. And you want to pull just a little bit right where that balloon sits, right at the bladder entry, just so you don't have any like leaking or anything like that. You can go ahead and disconnect that. And then I would go ahead and take care of my bag. I would go ahead and tape this to my patient's leg. It normally comes with a really nice device that fits that catheter right in on the patient's leg with a nice adhesive. And then make sure the bag goes below the patient. And normally you can hang that right on the side of the bed. Tends to do a really good job. And then I can clean up everything, go ahead and take this off my patient, make sure that they're comfortable, make sure that their bed is lowered to an appropriate level, and make sure that they're comfortable. And that's it. Thank you.